So the United Kingdom is recording tens of thousands of new COVID-19 cases daily and facing growing concern that the situation could soon get out of hand as the Omicron variant takes hold. Yesterday, the UK reported over 93,000 new infections, a record high for daily cases in the country. For the latest update on the COVID-19 situation in the country, we're joined by Senior Clinical Lecturer at the University of Exeter Medical School, Dr. Bharat Pankhania. Doctor, very good evening to you. Welcome to News at Prime. So 93,000 plus cases reported yesterday, Friday. Back today again with more than 90,000 new infections. What is driving this surge in the UK?
So we've got obviously the presence of Omicron, which is much more infectious than the previous variant Delta. And as a result of a perfect storm, and the perfect storm is as follows. Number one, the arrival of Omicron. Number two, it is now the winter period in the northern latitudes. And number three, also, it is the Christmas season where there is more parties gathering, people moving around shopping. So all those perfect storm issues put together will create a perfect storm of rising case numbers, especially from a more infectious Omicron variant.
And as far as Omicron is concerned, the UK is sitting with just upward of 24,000 Omicron cases. I wonder if that differentiation makes any difference in the response to the pandemic, given that Delta is still predominant.
Well, in Scotland, we hear that it is already the dominant variant. And furthermore, the estimates of Omicron cases is usually an underestimate because there are many more people who may be already infectious, but have not been tested or tested properly. So we should always take it with a pinch of salt as to the actual number of cases. But nonetheless, the evidence is there. Omicron is widespread and there is community spread of infection in the United Kingdom.
Mm-hmm. And in some of the reporting by British media today, there was said to be a briefing given to Cabinet on the trajectory of the COVID-19 pandemic. Some apparently in Cabinet, in fact, want an introduction of tougher restrictions after the Christmas holiday. Would the restrictions be effective then, given that people are going to be mixing so much over the next week already?
This is a very important point, and I almost feel like history repeating itself when, unfortunately, the United Kingdom had to go into prevention measures soon after the last Christmas 2020. So if you ask me as an infectious disease doctor, what would I do? My advice is act fast, act early, act extensively. So if you were to apply the brakes sooner, as soon as you knew that there was trouble, and you applied that brake extensively, you subdue the rise in number of cases, and then you see yourself through the Christmas season into the new year. So the best time to act is as soon as you know there's trouble ahead, and you act extensively.
And Dr. Pankhania, here in South Africa, there's been no change to our lockdown restrictions because currently, yes, cases are rising, but we're not seeing a surge in people being admitted to hospital. Is it still the same for the NHS in the UK?
So that comparison is often made, and what we need to immediately be aware of is my fellow brothers and sisters in South Africa, are of a much younger age. That is the big issue. So difficult to compare. And furthermore, Omicron has been in circulation in the United Kingdom, Europe, only recently, and there is always a lag period. Now, I hope that it doesn't translate into excessive hospital admissions. If that is the case, all is well and good. The trouble is, we just don't know, and we are in the lag period, that period between Omicron circulating in the community, and then it takes a couple of weeks before cases start to arise. So we will know more very soon, in a couple of weeks' time.
What are your thoughts, Dr. Pankhania, on using the number of deaths in relation to the daily infections as a measure of how serious this moment is in the pandemic? I know in the UK, in the last 3 days, there have been more than 78,000 daily cases picked up. Yesterday, the number of deaths, I think, was around 110. So is that how we should be measuring the seriousness?
No, not at all. it is one important parameter to measure, which is, yes, unfortunately, it is killing people. But the other measure, which is really, really important as well, is how many hospital admissions are we getting? Because when you get hospital admissions, even if you don't get death, it implies you go in and for the next 2 weeks or so, that bed is occupied. So therefore, for that period, other health activities like your cancer, like your heart disease, like your strokes, your renal problems, all those problems cannot be dealt with properly. So there is a concertina effect of hospital admissions preventing you from doing other important, urgent things to people. And then, unfortunately, those people with their heart attacks, their strokes, their cancers also die because we couldn't go in early enough.
How helpful then are the boosters? The UK currently is giving a booster to anyone who will take it. I know initially there was quite a backlog in terms of people who were trying to book on the online system and unable to get an appointment, so to speak. But how helpful is a booster given that the country is already in the middle of a dramatic surge and there's always a lag from when you get inoculated to when you do have the benefit of protection, added protection in this stage because it's a third shot?
Yes, so the advice from an infectious disease expert would be have your booster, have it as soon as possible. And our reasons are we have got Omicron in circulation. And Omicron has got so many mutations that it is bypassing a significant number of the antibodies that were created by the vaccines. So we need more of the antibodies to cancel out the defenses that Omicron, the new variant, has. So how effective are boosters? Vary in that they boost your level of available antibodies. But what we really must do is not rely on I am boosted, therefore I am okay. The best protection ever is not to get in touch, in contact with the virus, not to get infected. So you wear your mask, you wear it properly, and you take precautions in crowded places when you're interacting with other fellow human beings. Prevention is always, always better than to say, I'm boosted, I'll be okay.
Dr. Bharat Pankhania from the University of Exeter Medical School. Always good to speak to you, sir. Thank you for your time tonight.